I say this often, my mum and sister are NHS nurses, so first and foremost, I want them and all the other nurses to be paid fairly, right? However, the flip side of this, as a mum, I had the misfortune to have a complicated pregnancy, and my little boy was born very, very prematurely and spent a lot of time in intensive care, which was one of the most scary experiences of my life. There was one-on-one kind of nurse-patient care because he was so ill. And the thought of my little boy or anyone else being in intensive care and nurses just saying, do you know what, I want a few hundred extra quid, so see you later, off I go. It makes me, I've got goose pimples now thinking about it. It makes me very sad, very upset, and I think it's wrong. Where do you stand on it?
Well, I think the status quo is wrong. I mean, I was relayed a story recently of a woman who had an ectopic pregnancy while she was working on her business. She was in a warehouse. She collapsed. She would have bled to death. She called an ambulance. It didn't arrive. She was found by her husband. She would have died, I think, if he hadn't turned up. There are lots of stories like that happening every day. One study out there says we're having 500 sort of surplus deaths a week because of a lack of capacity in the NHS. That's speculation. What we do know is we're around 47,000 nurses short, which means that there's permanent crisis and incapacity in the NHS. Their argument would be we need to increase pay to recruit more nurses to address those problems. So short-term pain for long-term gain. But you're absolutely right, hugely controversial, and it's going to inconvenience people more than most strikes, right? If there's a rail strike, you can't go to work that day. But like you say, if a woman miscarries on those days or somebody has a heart attack or a stroke, it's serious.
If someone is going to go on strike and there is a real possibility that someone could die as a consequence of this, I don't think they should be allowed to go on strike. So I do believe that there should be something mandated in emergency services, so similar to what is in the police, prison officers, whatever, that you can't. If your job is literally life and death, then you can't strike.
Well, their argument would say that people are dying every day because of Conservative underfunding in the National Health Service. That would be their argument. They would say bad things are happening to an extraordinary extent. Look at, for instance, ambulance waiting times. You know, people are calling ambulances. There was an awful story of a gentleman who passed away. I think he waited for 6-7 hours for an ambulance to arrive in the West Country. He called his son. He spoke to him. He said, look, no, the NHS is sending an ambulance. Don't worry, I'm fine. It'll be resolved. He died on the floor. He was in his 80s. He had multiple children. And you think this is happening a lot. And look, nurses getting a pay rise isn't going to solve all of that, but we do need to be paying more nurses in particular because of this shortfall. Like I say, 47,000 nurses short and midwives too. So I support them.
Are you a nurse? In particular, are you an intensive care nurse, a cancer care nurse, an A&E nurse? If you are, then tell me, how do you... I'm going to be really blunt. How do you live with yourself, looking at your patients in intensive care and literally walking out because you want more money? How do you live with yourself? I wouldn't be able to, and I think that you're wrong. So tell me your thoughts. Where do you stand on it, Charlotte?
I think you're right, Michelle, that ultimately our health professionals, our clinicians, are there to save lives, to protect patients, and a 48-hour walkout with the threat of not providing cover, that minimum service that you're talking about, for those areas of the NHS that literally means if if a nurse isn't there, you could die as a result, or you could end up with a severe disability because you haven't been treated in time. And therefore, I'm sympathetic to the argument that nurses want a fair pay deal. Of course they do, as does everybody in every sector. But I think the risk involved of this sort of scale of strike is too much. But I do just want to pick Aaron up on a couple of points there, because he was spot on when he said increasing nurses' salaries isn't going to solve the sorts of issues that he was indicating there. So let's take those delays to ambulance times. We have seen a much bigger increase in ambulance staff since 2018 than we have done in demand for ambulances. So there are more staff than there are people calling out for ambulances. The problem is not staffing levels. The problem is not staffing levels in A&E. There are almost double the number of emergency medicine doctors in A&E than there were in 2010. And attendance at A&E, people turning up in A&E, has increased by nowhere near that. The problem is social care and investment in social care, because we can't get people out out of beds in hospitals, and the problem is in the management of the hospitals themselves. That is nothing to do with the number of nurses or the number of doctors that are currently in hospitals. There are far more of them than there were a decade ago.